Have you ever heard of Keytruda? It's a powerhouse drug from Merck that's completely changed the game in cancer treatment. Approved for 18 different types of cancer, it has generated a staggering $146 billion in sales, making it one of the most successful drugs in modern oncology. It's a true landmark in immuno-oncology, saving lives and delivering huge returns for shareholders. But now, Merck has released a new version, and it's stirring up a major debate. It's called Keytruda Qlex, and it's a subcutaneous formulation. What does that mean? Instead of a lengthy hospital infusion that can take hours, patients can now get the same drug through a quick injection that takes just a few minutes. Sounds amazing, right? On the surface, this is a huge win for patients. Imagine trading hours in a sterile infusion center for a quick clinic visit, or even an at-home injection. This convenience could dramatically improve a patient's quality of life and even boost treatment adherence, especially for those who find frequent hospital visits exhausting. For our healthcare system, it means more efficient clinics and less strain on busy infusion centers. It's what we call human-centered design, where the patient experience is prioritized. This is especially important in our post-pandemic world, where everyone values efficiency and reduced exposure. But here's the controversial part. Merck is charging the same price for this convenient new version as the original infusion. We're talking about roughly $200 for $1,000 per patient per year. Health economists and policy experts are raising their eyebrows. They are asking, is a simpler delivery method truly worth the same price as the groundbreaking therapy itself? Let's look at the data. Real-world evidence suggests that subcutaneous formulations can indeed improve treatment adherence by 5 to 15%. Better adherence often leads to slightly better outcomes, like improved progression-free survival, especially in older or more frail patients. However, when health technology assessors evaluate the cost-effectiveness of new treatments, these small gains from a change in administration route typically don't justify such a high price tag. Essentially, Keytruda Qlex is a significant improvement in convenience and operational efficiency, but it's not a breakthrough in the drug's effectiveness or safety. This strategy isn't unique to Keytruda. It is part of a broader trend in the pharmaceutical industry often called product hopping or patent thicketing. By filing over 300 patents related to Keytruda, Merck has built a fortress around its blockbuster drug, delaying the entry of cheaper biosimilar versions. This keeps prices high for the healthcare system and can stifle competition. Dr. Benjamin Rome from Brigham and Women's Hospital put it perfectly when he said, "We probably don't want to be paying so much for small additions on the tail end of a product that has already made billions of dollars." This highlights a growing tension. We want to reward companies for genuine innovation, but we also need to control costs. When the innovation is more about convenience and extending a patent's life than about a fundamental scientific leap. With Keytruda's main patents set to expire after 2028, Merck is already looking to acquisitions to fill its pipeline, rather than focusing purely on in-house R&D for the next big breakthrough. This creates a cycle where incremental updates are prioritized over transformative science. So Keytruda Qlex represents a new era of the convenience premium in medicine. It's a product that patients and doctors will undoubtedly appreciate for its simplicity and time-saving benefits. But it forces us to ask a tough question: should minor improvements in user experience command the same billion-dollar price tag as the original life-saving discovery? Moving forward, the industry and policymakers need to find a new balance. We need a system that continues to reward true scientific breakthroughs, while ensuring that pricing for incremental improvements is fair and reflects their actual value. This will be key to fostering a healthcare ecosystem that is both innovative and sustainable for everyone. What are your thoughts on this? Let me know in the comments below. Thanks so much for watching. If you found this breakdown insightful, please hit that like button and subscribe for more deep dives into the world of health and economics. See you in the next one.